Hi, good afternoon or good morning if you are on the West Coast where our speakers are from today. Thank you everyone for joining us for today's webinar. My name is Nastasia Walsh. I'm a program manager at the National Association of Counties, and I'll be moderating today's webinar. This webinar is part of Stepping Up, which is a national initiative to reduce the number of people with mental illnesses in jails. Stepping Up is the result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. And we receive generous support from the U.S. Department of Justice's Bureau of Justice Assistance and other private sponsors to do this work. Before we begin, just a couple of technical details to make sure that everyone can view the webinar. Also, just so you know, the webinar is being recorded. It'll be posted on the Stepping Up website. After we close everything out for future viewing, you will receive an email within the next 24 hours with a link to the webinar recording as well if you want to access it there. Also, just to the right of your screen, you'll notice there's a control panel, and in this panel there is a questions box. You can use this box at any time to type in any questions or send us a message if you're experiencing any technical difficulties. If you're having technical issues, we'll respond to you in that questions box. But we will do, during the Q&A session, we will go ahead and read any of the content type questions for our speakers on your behalf. If you want a better view of the presentation, you can click on the small red arrow in the top left corner of your screen. Since we have already had, this is our fifth in the series so far for Stepping Up in 2017, so I'm not going to spend a lot of time talking about what Stepping Up is. So if you don't know a lot about the initiative, I would strongly suggest that you look at previous Stepping Up webinars on the Stepping Up Toolkit Resources page, which is stepuptogether.org. Or please feel free to reach out to any one of the folks who are going to be on the last slide of this webinar to get more information about the initiative. Just a really quick update that we now have 383 counties across the country that have started to sign on to the initiative by passing a resolution or a proclamation to support activities within their county to reduce the number of people with mental illnesses in their jails. So please feel free to check out stepuptogether.org for a list of all the counties by state who have joined the initiative. And if you don't see your county name up there and you think it should be, feel free to email us a copy of the resolution and we'll make sure that we add you on there so that you can be recognized as part of the initiative. Now I'd like to introduce briefly Maria Fryer, who is a policy advisor for substance abuse and mental health at the Bureau of Justice Assistance at the U.S. Department of Justice. And Ms. Fryer is going to talk a little bit about, BJA's interest and support in Stepping Up. Maria?
Thank you, Nastasia. Hello and good afternoon, everyone. My name is Maria Fryer, and I'm a policy advisor at the Bureau of Justice Assistance. I oversee the justice and mental health portfolio through BJA, as well as a number of national centers and cooperative agreements that bring training and technical assistance to state, local, and tribal communities across the U.S. to improve the justice system response to people with mental illness and co-occurring disorders. The justice and mental health portfolio includes a number of initiatives and national efforts to reduce the number of people with mental illness in county jails, strengthen systems that connect people to treatment, and reduce recidivism. Among many efforts, two initiatives that complement Stepping Up and today's webinar are the Police Mental Health Collaboration Toolkit, an online one-stop shop to help law enforcement and mental health providers design their response strategy and plan for long-term sustainment through policy and practice, and the Justice and Mental Health Collaboration Program, which promotes cross-system collaboration between justice and service providers. We are extremely excited to soon award together approximately 55 counties, law enforcement agencies, and state systems that will soon benefit from the support, technical assistance, and the networking opportunities the program provides. I like to think of JMHCP as that big program in a small package that may not receive as much it truly needs in terms of dollars, however, creates a huge impact on communities, creating long-lasting positive change that is incalculable. We are happy to support this webinar today, prioritizing prioritizing policy, practice, and funding improvements for people with mental illness in jails, which is a series of Stepping Up webinars to keep talking to each other, supporting each other, and learning how to plan and carry out system-wide strategies at the local level. I would like to extend a big thank you to the panel speakers on today's webinar, Hallie Fader-Toe, and Commissioner Frank Wolf and Deputy Director Katie Lindstrom, as well as Justice and Mental Health Collaboration Coordinator Roseanne McPhail. Again, thanks for being here and attending. Back to you, Nastasia.
Great. Thank you so much, Maria. I appreciate that, and really excited to hear about the grant awards that'll be coming out very soon for all of the counties who are working on this issue, and any new opportunities. I know you guys always keep us apprised of new funding opportunities as well. So thank you so much for being on the call. So on today's webinar, we are going to discuss key strategies for prioritizing policy and funding for people with mental illnesses in county jails. We know that prioritizing can help county planning teams to identify action items that they need in order to reduce the number of people with mental illnesses in their jails, and really to help sort of create detailed proposals and ideas for moving forward on these pieces. So today you will hear from, as Maria said, Hallie Fader-Toe from the Council of State Governments Justice Center, as well as presenters from Pacific County, Washington. And I'll go ahead and introduce those speakers as we move along. First, we'll hear from Hallie Fader-Toe, who is a Senior Policy Advisor at the Council of State Governments Justice Center. Hallie works with local and state policymakers to craft policies, processes, and programs that will work best for their jurisdictions. She has also worked with jurisdictions around the country on collaborative, data-driven planning and implementation efforts to address criminal justice functions from initial detention all the way through reentry, including a focus on individuals with mental illnesses. So Hallie, I'm going to go ahead and turn it over to you.
Great. Thank you, Nastasia and Maria. It's an honor to be here presenting on Stepping Up, and particularly for this topic. So I'm very much looking forward to today's conversation. As we move through the webinar today, my job is to provide a frame for thinking about question 5, which is providing policy, practice, and funding improvements. So my goal in the first section here is going to be to highlight some key questions for your teams to be considering as you're moving through this step of Stepping Up, as well as to illustrate some concrete strategies that can be used to answer this question well, and that will tee up the more extensive case study by the group in Pacific County, Washington. All right, next slide, please. So as Nastasia said, the Stepping Up initiative is framed around 6 questions county leaders need to ask. And this is the framework for bringing teams together in a collaborative, data-driven planning process. As you'll see here today, we're focusing on question number 5. Have you prioritized policy, practice, and funding improvements? And I'm particularly excited to be talking about this with you today because this is the money webinar. This is the, I'm tempted to say, look under your seats and you'll find. But we know that counties that are starting to think about mental health and jail diversion are very eager to answer the question of, okay, so how are we going to pay for it? And today's webinar and question 5 are really where the rubber hits the road in terms of your Stepping Up planning. Working through question 5 is the difference between a well-done strategic plan that sits someplace and a real change in the way business is done locally. So we're very excited to talk through this with you and to start to hear examples from the field as more and more of you are working through question 5. Can I have the next slide, please? So the Why is question 5 important? Again, I think money is one of the first questions that people come to stepping up with, but the theme here is really that we want to help you go as far as you can with the money that you have. So think about how to make each existing dollar count as much as it possibly can. And then think about how to make any new money go as far as it can in advancing the plan that you've worked on in your county. Nastasia, can I have the rest of the animation, please? So question 5 will help you go from the work that you've done so far in developing baseline data, setting measurable goals, identifying gaps, to really connecting funding sources, both existing and we're hoping new ones. So question 5 is giving gas to your county plan. And as the diamond to the right of the slide says, this is an important place to think about how you're engaging county budget staff, whether it's within your own agencies or through the county commissioners or supervisors or county executive. It certainly pays to have them involved as early as possible so they understand the considerations of your planning process and can help you identify strategies, again, to give gas to your plans. Next slide, please. And we'll animate through this, please. The checklist for question 5, this is going to show up on page 11 of the 6 questions report. So if you're on the Stepping Up website and you're looking at 6 questions, or this is the checklist. This is what does it look like to do question 5 well. First, prioritize strategies. And here's really where you're taking your work from question 3 on setting baseline data for the 4 key measures and setting measurable goals. The second check is really focused on question 4, the identification of the gaps that you have, the description of the gaps that you have identified through your planning process. And now here's for check 3, what is going to be the impact of the new strategies that you're proposing? How do you see the new thing that you're working on impacting those 4 key measures? Next slide, please. As discussed earlier, first animation, we like to help you use existing funding to go as far as you possibly can, and then take new funding and use that to address the gaps that have been identified through your planning process. And throughout this webinar, we'd like to put 2 scenarios in front of you. One of them is a soup to nuts stepping up planning process. So this is where a new task force has been set up, or a new project and an existing Criminal Justice Advisory Council has been set up to do a stepping up project. And you're working sequentially through the 6 questions to develop a stepping up plan that has identified gaps and identified funding streams. That's scenario 1. Scenario 2 is the situation that we face from day to day, where you have ongoing budget cycles, new solicitations or new grant opportunities that come up. And we want you to be thinking about how these new funding opportunities can give gas to your existing stepping up plan. I'd like to go to the next slide. Great. So to illustrate that second scenario, what we understand often happens is that a solicitation is released to the field, and here we're showing you a picture of the Justice and Mental Health Collaboration Program grant that Maria talked about earlier. That came out this spring. Keep your eyes open for it next year, of course. So a solicitation comes out to the field, and then somebody reads it and says, oh, good, we got to get the team together, talk about what we're going to do with that solicitation. So the team gets together, says, oh, okay, this is what it looks like BJA is looking for. You know, judge is really excited about mental health court. So maybe what we should do is work on a mental health court. Oh, actually, I just went to, you know, I had just heard about that police mental health collaboration toolkit. You know, we've had a number of requests from law enforcement for more assistance. Maybe we should be thinking about a law enforcement response. So in response to the solicitation, the group sort of talks through local dynamics and focuses on one program. So they say, okay, you know what, JMHCP, we're going to propose a co-responder program. We're going to use our state mental health funding to pay for an ACT team, and there's a local foundation out there that can answer that mental health court need. So they've sort of, in an ad hoc way, responded to the solicitation based on the things that are sort of burning at that moment. Next slide. We like to propose a change to a new way of thinking about things. So under the stepping up model, great, you can go with the animation, thank you. A county has worked through question 3 already, come up with some numbers for the 4 key measures, and these are all made up. So they know what their admissions look like, the average length of stay looks like, their connection to treatment rate, their recidivism rate, and they've set a reduction goal in this case. They've also worked through question 4, and they've identified that the response for mental health law enforcement calls is an area where they really need to do work. And they have identified that that's something that they can do to reduce the mental health admissions in their jail. So they're planning to impact key measure number 1. Next animation, please. So they have, and this will be familiar from the Stepping Up 6 questions document. They have identified the gap. They've got the data behind it. They have an objective in place. They know which measure they're going to impact, and they've costed out the different types of costs that will be needed to support this response. So they know that they need to think about time for law enforcement and mental health staff, training, IT, and they've identified some potential funding sources, both locally, at the state level, thinking about federal grants, thinking about private foundations. And they've identified the data they hope to track to see whether what they're doing is going to work. Next slide. So instead of the solicitation triggering a meeting that sort of bops around different ideas, they see that solicitation and they already have in mind a number of goals that they that are based on their local data and gaps, and they know that they want to increase the number of trained officers with the goal of reducing daily jail admissions. Next animation. And so they're going to use the different funding streams from BJA's, JMHCP solicitation, to the state mental health funding, to the existing, to the local foundation, to pay for different components of that response. Next animation. The overall goal here really is that the whole funding picture is being used to achieve the goals set through the planning process. The programs or the funding strategies that are selected address the identified gaps and obviously honor the criteria for the different funding streams and the availability for those different funding streams. So this is the vision for question 5. And now we're going to work through a couple of the specific considerations before moving into the Pacific County case study. Next slide, please. I'm hoping this looks very familiar to you all as it does to me. These are the 4 outcome measures that we're really pushing. This is in question 3 of the 6 questions. We know that these are the 4 things that can impact the number of people with mental illnesses in jails. And as Nastasia animates through this slide, what will appear are different strategies that are used to impact each one of these outcomes. So in blue, we can see that police mental health collaboration programs can reduce the number of people with mental illnesses booked into jail. Moving into red, routine screening and assessment can be used to help shorten the average length of stay. In green, expanding community-based capacity for treatment and housing can increase the percentage of people connected to care. And in purple, applying an R&R principle can help reduce rates of recidivism. So as you're identifying your key outcome measures in question 3 and thinking about how to ways that the criminal justice system can respond to impact these measures and other systems as well, here's a menu of options for you. We hope this will be a helpful reference slide. Next slide. Another helpful reference, we hope, this talks about the different components of a system of care that could be funded. So as diversions or connections are made from the various points in the criminal justice system on the left of the slide, on the right of the slide is a circle representing different components of treatment, services, and housing that could be either gaps in your community and then fueled as you're going through question 5. Next slide, please. So I'm going to do a very quick example of what this looks like operationally using our friends in Santa Clara County, California, who've been very generous in sharing their experiences before we move into the Pacific County case study in more detail. So Santa Clara County started a jail diversion project. They brought together all of the representative leadership that you would see in question 1. They have thought about screening and assessment in question 2. And what I'm going to show you here is how they moved through questions 3, 4, and 5 to prioritize policy, practice, and funding based on their measurable goals. So question 3, they developed baseline data, and the tiny animation that we'll show here is a picture of the baseline data that they were able to cobble together using existing systems. So one of those is a picture of data from the Custody Bureau and the Sheriff's Office, and the other is from Custody Mental Health. So these were existing data systems that they pulled from to help develop baseline data. Then they did an inventory of existing resources. So that included some sequential intercept mapping as well as discussion of processes. In addition to the little picture that we'll show you here, which it was developed by their Behavioral Health Services, Criminal Justice Services Department, which demonstrates their capacity for different types of programming. So behavioral health programming for justice-involved people. This is the number of slots they had. And that led them to prioritize funding based on measurable goals. And the picture here is what their report to the Board of Supervisors, which are the county commissioners in California, looked like, which included their baseline data, their goals, and their funding strategy. And I'm showing you here an excerpt from those goals, just so you can see what we're talking about when we're talking about measurable goals. The first one they said is reducing the number of people who are on their jail assessment coordination list. That's the people who are in jail awaiting treatment in the community. And they know that they currently have 80 to 100 people who are daily on that list, and their goal was to reduce that list, eliminate it to the point that there was no more. Another goal was reducing the number of people who are booked into the jail. So this is the admissions number, and they knew what their current admissions were, and they knew they wanted to reduce that, by 250 people over 2 years. And finally, they wanted to reduce the average length of stay for people with mental illnesses based on they had their current lengths of stay, and they set a goal for reductions. And you'll see that they had very different numbers for men and women, and so their goals reflect that. Next slide is some great reminders just to have on hand for all of us who are writing budget proposals and grants. This is sort of vitamins and vegetables. Remembering to use data to demonstrate current capacity as compared to the current need. Using data to demonstrate the numbers to be served, and again, really tying that to impacting at least one of those 4 key measures. Bringing the human story and the story from advocates into how you're explaining the situation and the outcomes you're hoping for. Being realistic about the projected costs. And as we've been talking about today, identifying both existing funding that you're leveraging as well as new funding opportunities. We'll quickly show what this process looked like in Santa Clara County. In the first animation, this is when their jail diversion subcommittee formed. They developed 35 recommendations. They prioritized their recommendations, set time frames, estimated costs, and identified leads. As they were preparing to present this to the Board of Supervisors, they focused on 10 recommendations. They identified where they were leveraging existing resources. They included recommendations that will be very familiar to those of you who've been following along with us in Stepping Up: screening and assessment, treatment, housing, supervision, data collection, and pegged those to different available funding streams, state mental health funding, some justice grants that are available in California, Medi-Cal, and county general funds. And then they triaged the recommendations that could be started immediately without additional money, as well as some of the longer term, larger investments, and figured out how those were going to be staged over time. In the next animation, you'll see that these recommendations were adopted by their Board of Supervisors, and the county is now in their implementation process, where they're tracking outcomes and working through their implementation plans. And so we'll be excited to see how they're faring with meeting their goals and the lessons learned, because we know, the difference between a plan and implementation. There's a lot of lessons learned in there. I'm going to conclude with 2 slides that I hope will be helpful references for you. I wasn't able to provide money under your seats, but this slide is a list of potential sources of funding at the federal, state, local level, as well as different private sources that we know counties look for funding. And obviously this slide is available as a handout for this webinar. And then the next slide gives you some more strategies to talk through, to consider, in terms of leveraging state leadership to build health treatment capacity, including strategies for leveraging Medicaid. We're particularly excited to see how many state leaders have stepped up to help counties in their states in achieving their Stepping Up goals, and that there are many states where state justice and health leaders are looking at the way their grants are written or the way that health funding is put together to both remove barriers to counties as well as create opportunities for counties that are going through this thoughtful, data-driven process. So I will conclude there in terms of the introduction, and I'm looking forward to hearing from our friends in Pacific County, Washington, about how they've been implementing these strategies.
Great. Thank you so much, Hallie. I appreciate that. A really good sort of overview and some strategies about, how to make this actionable in your county. So I appreciate that. And we did, I know we're saving questions for last, but we did get a question about how to access and find out about all of these different funding opportunities like Justice Mental Health Collaboration or any of these other opportunities. And so I would definitely recommend to folks, we do send a lot of that out through the Stepping Up listserv. If you are part of that listserv, if you're not part of the Stepping Up listserv, and if you were part of it, you would be getting email notifications about things like these sort of webinars and other events that are happening through Stepping Up. And you can sign up on the Stepping Up website by clicking on the Take Action button, which is like a big red button on the main website. But you can also sign up on all agencies have an email updates on different solicitations that are out there that might be useful to you. So sign up for the Stepping Up listserv, and we send out some of these, but obviously sign up for some of those federal listservs as well, and anyone can sign up to receive those. So I'm going to move on now for our folks in Pacific County, and so I'll just briefly introduce everybody there. So first we have Commissioner Frank Wolf, who was elected to the Board of Commissioners in Pacific County in 2012. Commissioner Wolf's interest in behavioral health grew County's Justice and Mental Health Collaboration Program. And she works on developing collaborative relationships for this work, outreach to community and stakeholders, system mapping, data collection, team organization, and reporting. She really helps to be the liaison between all of the different agencies and leadership in Pacific County on this issue. She's also on the Mental Health Diversion Program Steering Committee and participates in their Law and Justice Council as well. So I'm going to turn it over to our Pacific County team. The floor is yours.
Thank you, Nastasia, and this is Roseanne. I'd first of all just like to say thank you for inviting us to have this opportunity to just kind of share where we are and what we've done with this work so far. And I do want to just start by saying that we did kind of start our work as a Category 1 JMHCP grant recipient. So thank you to BJA for this question around prioritizing policy, practice, and funding improvements. We're hopeful that this will be helpful to those of you on the call, and just remembering that it may look a little different for us than it does for others. We're going to start with our Commissioner Frank Wolf, and he's going to share some information with you before we move on.
Thank you, Roseanne. Yeah, I like to think of Pacific County as perhaps a scale model for other jurisdictions. We're just under 1,000 square miles of land area and about 21,000 or a little less than 21,000 permanent residents. Looking at the map, the finger standing up on the left-hand side is the Long Beach Peninsula, and more than a third of the population lives on that sand spit. That sand spit therefore has about 8,000 or 9,000 permanent residents, but that population can easily swell to 50,000 on a good summer day or 100,000 on a really good holiday weekend, which causes some infrastructure problems that we have to deal with in and aside from mental health sort of stuff. When I ran for office originally in 2011, 2012, one of the issues that was being talked about toward the election was what we call the 1/10 of 1% tax. It's a sales tax that the county commissioners were empowered by the state legislature to slap on within the county. The funding would go strictly for chemical dependency and mental health programs, but within those broad categories, the spending was very flexible, which is for other commissioners probably something that's very welcome. And that kind of brought my awareness up. Once I was elected, I ended up, as was alluded to, on the board of Timberland Regional Support Network, which was in charge of getting Medicaid and other behavioral health funding to the county. and that went out of existence in 2016 and was reborn as Great Rivers Behavioral Health, which we call GARBO. And I sit on the board of GARBO. And that really has kind of focused the awareness. In working up toward passing the 0.1% mental health tax, and I think we can go to the next slide. We, the commissioners, were fairly heavily lobbied to pass this tax when I was first elected, and we did pass that. 0.1% on our sales tax here equates to around $250,000, give or take, a year, and that has been put to really good use. We, the commissioners, were made aware of the fact that we already treat people with mental health issues and behavioral and substance use issues. We house them in our jail. Usually that amounts to mostly warehousing, and we could do better. We were not doing very well, and it was, in many cases, a revolving door. So using some of this new money, the 0.1% money, we wanted to start making a commitment to do things a little differently. This is important to me as a commissioner for two reasons. I don't know about other people, but the reason I ran for commissioner for the office was to help people. I know that sounds a little bit blue skyish, but I don't know why else you'd want to do this job. And seeing people who were not getting the treatment they needed was kind of hard to deal with, especially when providing the treatment is not as expensive as what we're doing already, which isn't helping anybody. So the other side of that issue is if you help people, you also end up saving money. Next slide. Okay, costs associated with mental illness and substance use disorders. Again, this is something that GERBO is doing. Moving toward 2018 to 2020 timeframe when, again, we're going to change the way we fund in Washington State, but that's kind of out there on the beyond the horizon. So the financial and humanitarian side we talked about, having people like Katie and Roseanne working for the county who are committed toward this and know what they're doing really helps a lot. As a commissioner, I'm very familiar with the phrase that, did you want to talk to the man in charge or the women who really make it work? And these are two of those women here. Anyway, as a commissioner, I think the most important thing I can do is educate myself, educate the other people around me, and ask the right questions. So with that, I'm going to ask for the next slide and slip it over to our next speaker.
All right, this next slide here is just for people to have a look at, but if you can go ahead and move to the next slide, please. This is Roseanne.
Hello.
There we go. Perfect, thank you. So I just want to talk for a few minutes about the importance of planning in this whole process and really understanding for us how essential that was to get to where we were with prioritizing and really looking at funding, but having a really mindful and thoughtful process and what that looked like for us. So it was really important for us to get, as was referenced earlier, the team together and really looking at drawing a diverse team together. We did start out, as I said before, with the JMHCP Category 1 Collaboration and Planning Grant. As soon as we received that grant, our county elected officials did pass a stepping up resolution and really made this a priority for the work that we were going to be doing here. We did look together. We have a planning team, and our planning process may look a little bit different. Is we have a core team that consists of Katie with a county. We have behavioral health. We have the jail administrator. and myself on a core planning team. But in addition to that, we utilize other teams that are existing, such as our Law and Justice Council, our Behavioral Health Subcommittee, which is underneath the Human Services Advisory Board. And then we also pull together a law enforcement work group. So for us, based on just as you saw with Frank's slide on our geographical location and demographics, one of our challenges in planning is it's not always easy to get everybody at the table, and a lot of people wear multiple hats. So we had to sort of accommodate and look at our planning team as multiple teams, and then how do we bring all of that information together? And part of my job is really coordinating that information and helping us in this process of really prioritizing. So that kind of explains that. And then, of course, the accountability for results. So next slide, please. And you can just go ahead and populate this. This just sort of shows the team. We really have our core team, but as you can see, we have a lot of collaborative partners. And again, for us, it was really looking at all aspects. And when Katie delves into what our sequential intercept mapping looked like and shows you where our priorities came out, we were really mindful about looking at all the partners and really using that intercept map to see what does it look like in Pacific County and what are all those areas when someone would intercept the criminal justice system and what was working and wasn't working in each of those areas. So the other thing for us in the multiple meetings that we had was really getting to a place of shared vision. So and we found that easy. I will just say that, you know, obviously from the number of people that are on the webinar and the number of counties that are growing with this initiative, I've not met anybody that doesn't feel like this is really important work. And so it really is just being able to have the ability to pull people together, talk about what your shared vision is, and then really collaborate to come to that determination of what are your priorities and what can you do. And with that, I'm going to turn it over to Katie to kind of go into a little bit more detail around our planning process.
Thanks, Roseanne. So when we were working on the planning process and getting to actually prioritizing what are we going to spend our resources on, we followed the guide that was provided through JMHCP, the P&I guide. It was very helpful. There's a few sort of rural community twists or special considerations that we definitely came up against. And so we just want to share kind of how that prioritizing process took place for us. Of course, we started with our data and our sequential intercept mapping. And when I say data, I say that loosely. We actually found throughout the process that data was really hard to come by in a lot of cases. And so we kind of had to make do with the best that we could. When we couldn't find actual hard data, we would use national data and then populate that against our local population to get estimates. For example, estimates on percentage of individuals with mental illness in the jail. We took the national number, multiplied that against our local data, because that was the best we could do at the time, and we had to start somewhere. Because what we found really at the beginning of this is we were really starting with a blank slate. We didn't have much already built. So when it came to kind of thinking about needs and even data needs and program needs, it was everything. The answer for us was we need everything. So that made it, you know, nice in a way, sort of clean slate, and we move forward with a solid plan and know that almost anything we do is probably going to be an improvement. So anyway, so when I say data, that was kind of our experience with that. We were able to get some local data, and as part of our planning process and prioritizing, we actually identified the need to collect data and the need to create to have the data as an actual need. And you'll see that once we get to our actual plan slide. And so we did definitely identify the need for staff and a coordinator as extremely vital. So other things we looked at with our sequential intercept mapping is looking at efficiencies. So looking at what are things that might exist, current systems that maybe they're fledgling and could use some improvement versus building new. Anytime we do want to look at current systems and see if we can build upon those. That's going to be probably a less expensive investment than building something from scratch. The one example I can think of is we did have a kind of a fledgling therapeutic court system that was sort of informally ran, kind of on a volunteer basis. The judge and the prosecutor and some different partners were volunteering their time. And so that's something that, it wasn't a best practice model, but it was something where some partners were coming to the table and, putting forth some effort. So that is one of the systems that we ended up building upon, and we expanded those relationships with those partners to build a mental health diversion program. Another issue that we're looking at really heavily is capacity. So we're very, very small. We have some of the same hiring issues as, I think across the nation, but probably exacerbated somewhat given our very rural nature in terms of hiring therapists and whatnot. So really looking at what is the capacity of the behavioral health system, the current providers, and also the ancillary social service providers to actually take on new work. And that really is an issue for us. We have one primary provider of behavioral health in our entire county, and they have a core function to serve Medicaid individuals that they need to really be looking at, and that's their priority. So taking on additional new programs, for example, treatment in the jail or mental health diversion, those are going to be extras on top of their core functions. And so we really had to do an honest assessment of what is the capacity of our current providers. In an ideal world, we'd be able to just bring in new providers and build new capacity. But for us, that's not always realistic because we are so small and it is very difficult to hire and bring on new professionals in the area. So we took a good look at that. The next big area that we really looked at was the county investment and partner buy-in. So again, like I said, in our initial assessment, we kind of determined we were at zero, so we could reasonably choose anything and it would be an improvement, any strategy. So what we kind of married that against was just the county investment partner buy-in. Where was the energy at? Where were partners interested in what kind of projects were partners interested in working on? Where were they going to willingly give their time to be part of planning, to be part of implementation? You can have the best plan in the world, but if people don't want to do it, that's an issue. That's kind of similar to that strategic plan that's pretty and sits on the shelf, but never gets implemented. So a lot of our meetings really focused on buy-in, and back a couple slides ago, it showed our partners that we had talked to, the hospitals, prosecutor, our local law enforcement, our jail, all those different partners, and really doing a lot of group meetings, one-on-one kind of key informant interviews to really determine where the energy lies within our partners and what our partners see as gaps. Which again, when we're lacking some of that data, those key informant interviews can be really useful because where we might not have an actual percentage or a number on something, if we talk to the chief of police and he says, hey, this is a really big issue, that's pretty good information for us to use. We also really are looking at geography and kind of equity across the county. We're kind of an interesting county geographically, as Frank mentioned at the beginning. We have a long peninsula, and then there's about an hour of drive time from the peninsula up to the other populated part of the county, which again, about 10,000 people. So we have a North County, a South County. There's a big swath of nothing in between. And so when the county is really looking at issues, there's a sense out in the community of some sort of fairness and being able to serve citizens across the county. So looking at, is this something we can do in South County, North County, taking those things into consideration, and also looking at needs on the different ends of the county if the resources are limited. So very important, I think, with any planning process is this next step and really thinking about sustainability. We don't want to implement programs with a new grant, and then that grant goes away in 2 years, and now the program's gone, or the program is substantially less than what it should be. So we're really looking at sustainability when we're doing any of the planning. And sustainability doesn't necessarily have to be about direct funding from the county. It can be in-kind match provided by our partners. It could be state, local, federal funding. It could be leveraging, Medicaid funding and identifying areas where Medicaid could be paying for some of the services. Like Frank had said, our county commissioners passed the 0.1% sales tax, which really provides a significant, for us, source of funding to actually implement these different initiatives. And looking at, state and federal grants and leveraging our local funds so that we can make all the dollars go further. So the funding opportunities and the timing also kind of just want to bring up with our planning process. We were working through the sequential intercept mapping, and we did have an opportunity to get some funding to start a mental health diversion program. In an ideal world, we would have completed the planning process and then started initiatives. But with the timing of this funding opportunity with the mental health diversion, we ended up going after that. And so it was sort of a parallel process for us where we were doing the planning and at the same time separately starting up this program. Again, that's not ideal because you want to do your planning and get all of that completed before you start implementing. But the resources are limited, and I think it's important to just be aware of different opportunities. And if the opportunity really lines up with the work, which mental health diversion clearly did, go ahead and I think feel free to go ahead and go after that because you don't know when those opportunities are going to come up again. Now, that being said, you need to be careful of mission creep. You don't want to kind of go after funding because it came open and then it sort of takes you off track. So I think it's important to do that assessment of, is this really within our mission? Is it supporting our long-term goal? And for us, the answer to that was yes. Also under sustainability is looking at opportunities to leverage across systems. We, as a small county, I think an advantage for us is that human services sort of live all together in one department under just a few people. And so we're managing housing and homeless programs, and fairly parallel to this process, we were awarded a HUD permanent supported housing grant, also the mental health diversion program, and then the Justice Mental Health Collaborative. So kind of knowing and having the same people working on all of those different programs and systems, it made it really easy for us to leverage those programs against each other so that we have people in the mental health diversion program who are exiting jail and they're homeless. And so we're able to actually get them straight into our permanent supported housing program. And that's just one example for us in our county of a way we've leveraged. We have the housing case manager, the behavioral health case manager. They're working together as a team and providing true wraparound services. And soon in Washington State, we have a Medicaid waiver project that's coming up that will also be able to provide some supported employment and also some housing through Medicaid. And so those are other opportunities that we know that are coming up that we're looking to really weave in. They're not necessarily behavioral health specific, but they help to create that kind of continuum of care. So I think, if not, if you're not a small county where you kind of wear all those hats, and which makes it very easy to weave those funding sources together, at least being aware and sitting on committees or work groups or having relationships with the people who do control those other funding sources, I think is really important because you can really develop a strong system if you're able to weave things together. And of course, the ability to weave things together, and we have these other, that's definitely consideration when prioritizing. We're going to pick a strategy that kind of leverages in a lot of other money and resources over one that doesn't, if all created equally. So a couple other just points, definitely looking at it, adapting to changes as systems change, funding sources change, being able to adapt to changes is important. Again, you got to marry that against staying on message and avoiding the mission creep. And then our 4 key measures, which were gone over earlier in detail. Those are really the anchor to any kind of systems improvement programs that we're looking to implement. It's really going to be anchored under the 4 key measures. So next slide. And go ahead and animate through. So through our sequential intercept mapping process, these are the strategies that we ended up choosing and prioritizing. Some of these strategies were very low cost things to no cost. For example, getting the improved screening in the jail, having the
validated screener.
The validated screener it cost money in terms of some staff coordination to get it done, but really it was once it was done, now it's in their system. It's something that's not going to cost ongoing money, working with the jail staff so that they know how to implement it, and then creating the system to get that information where it needs to go. So some of the strategies were very low to no cost. Other strategies cost money. For example, permanent supported housing, which again, we leveraged a grant to help fund. Mental health diversion has been a program that costs money. And again, we were able to get a grant on that one also. Crisis team, that happened to be an opportunity. That crisis team was something that we definitely identified as a priority in trying to, avoid jail altogether in that first intercept. And there was an opportunity that came down through our Great Rivers Behavioral Health Organization, which is our 5-county behavioral health region. They were looking to fund crisis and improve crisis response in counties. So we were able to work with Great Rivers to use some of their funds to fit this need of something that was also identified in our county. So again, we're looking at kind of those win-win scenarios where another agency might have a charge to get this done, and then so we're looking for any of those opportunities to work together, so kind of create that synergy. Let's see. Okay. So anyway, this really is what our plan ended up looking like. Some of the stuff on this plan, CIT training, mental health first aid training, those were chosen because they're definite needs, and we also were able to partner with some local coalitions to help fund some of the training. Let's see, jail-based services, that was chosen. Again, we really had no jail-based behavioral health services at all. And the state recently had loosened up some regulations on one of their funding sources, so that we're actually able to provide some jail-based treatment services. And then the overarching over this whole plan is we're looking at any of these programs. If we can get a grant or a way to fund the program, we definitely do that. But we use our local money, our 1/10 of 1%, to provide matching funds, so that we're really making that local money go far. Just one example, the permanent supported housing grant was about $220,000 a federal grant. It required a 25% match. And so we're looking strategically about using that funding to match that grant, so that, number one, we can bring in that money. And, I think it was about a $19,000 investment for the county, we were able to bring in this HUD, the federal grant. So really the whole prioritization and funding picture, it's pretty complicated and it's very woven together, but it becomes pretty strong, I think, when you're able to do that, and you end up bringing in a lot of different partners who have a stake in seeing it be successful, which also reduces the workload of any one agency to make, when you have many people coming together. So that's definitely a high priority for us when we're thinking about what do we actually want to do.
And the next slide has your list.
Okay, so next slide. So this is a list of funding ideas, and of course this is going to be specific to Washington. Some of these probably apply in any state. So generally, when we're talking about funding ideas, looking at county funding sources, of course, first. For us locally, that meant our 1/10 of 1% sales tax. We have a millage fund, and it could be county general funds also. And depending on the state you live in, you may have different options to pass dedicated taxes to support behavioral health. For us in Washington, we did have that option with the sales tax. Again, depending on your state, in Washington, we have behavioral health organizations, which are the sort of the administrators of behavioral funding for counties. The behavioral health organizations administrate the Medicaid funding, but they also get like the mental health block grant. They administer the substance abuse block grant, some different federal sources, and some other sources that have a little more flexibility than just serving strictly Medicaid populations. So definitely would encourage relationships with your funding organizations, whether that's a state or if it's a regional BHO like we have. Like Roseanne said, our 2-year planning process was supported with a Justice Mental Health Collaborative grant through BJA, which again, thank you very much. We were very thankful for that. Having dedicated resource to the planning effort is absolutely vital. What we found is partners are really willing to come on board and they want to see this work done, but without dedicated coordination time, it's really difficult to get anyone to actually pull it together and schedule the meetings and do the reminders and kind of keep people on track. So that planning grant really was helpful for us, and it really pushed us ahead much, much faster than we ever would have without the grant. We also were able to tap into the Washington State Prosecutorial Diversion Grant. The True Blood Grant was actually a lawsuit against the state of Washington for the state wasn't getting people into beds like they should, and that money got put into a fund, and the True Blood Grant is continuing to fund our mental health diversion program. Of course, Medicaid, all states to different levels have Medicaid available for any services that Medicaid can cover. When you're looking at, for example, reentry planning, your reentry planner isn't going to be able to bill Medicaid while they do the service in the jail, but they definitely are going to be able to refer individuals to services that are going to be Medicaid covered out at the community-based provider. For us in Washington, we also have the Medicaid Transformation Grant through our Accountable Communities of Health, and they're looking at a lot of innovative projects, care coordination, kind of that bidirectional care. So looking at tapping into that, being at the table regionally for those conversations. We have Criminal Justice Treatment Account, which is another Washington State fund. Again, I mentioned earlier, partner match and in-kind. You can't oversell this. Your partners have an incentive to be involved in this, whether it's humanitarian or fiscal. Getting that shared vision and getting those partners on board it really can stretch what you can do just by getting the partners to actually provide some service or participate in a way that's going to help reduce costs. Good example of that is hospitals. They definitely have an incentive to make this better. Jails have an incentive to make this better. So because when it's not working well, it actually costs them money because people are inappropriately housed, in those locations. And then the last one is community coalitions, our substance use prevention, mental health promotion coalitions, our NAMI groups. They have a real incentive on the person side and community health side, and so can look at those groups for providing training and coordination. Next slide.
We just kind of wanted to take it back to just for us remembering that in all the work and all our planning and all our prioritizing, we're always going back to those 4 key measures and looking at those. And as we go through the process, we're also always monitoring and evaluating against those to make sure that we're on track. And next slide just has our contact information. I think we're just a wee bit over time, so apologies for that. And feel free to contact us if you'd like to.
Great. Thank you so much to the Pacific County team, all of you. I think this is really helpful and really comprehensive to show some of the work that you're doing. And I think, one of the key things that we're sort of taking away there too is the importance of having that staff person who sort of acts as the liaison between all of these different agencies and helps with the data and helps with the grant writing and helps really sort of keeping all of this stuff moving, as you said, schedules the meetings and make sure things happen. So, obviously key to have Roseanne in that position for you all. So thank you. So why don't we jump into Q&A? We've been getting several questions from folks throughout the webinar, and so if you have any questions, please feel free to type them into the questions box on your screen, and then I can read them aloud. I think because we're a little bit over time that we probably won't get to all of those questions today, so I would strongly encourage everyone to join all of us on the network call that we're having next week. On Wednesday, August 16th at 2 o'clock, we'll have the same speakers back on that call to dive even a little bit deeper and answer more of your questions on this topic. So why don't we jump into some of the questions here, and also just wanted to make sure everybody knew that the slides for the webinar are available on the dashboard that you're looking at right now under handouts. The slides are available there, and they'll be available on the Stepping Up website along with the recording after the webinar. Just give us a couple of days to set everything up. So real quick, why don't we get into some of the questions? So one of the questions came in for Commissioner Wolf, and it's really about sort of a two-part question. One, sort of how did you get all of you and the folks on the phone get all of the different players together? So it's your sheriffs and your judges and your DAs and other members of criminal justice and the public health and health department. How did you and your folks there sort of get everybody to the table to be part of this? And then can you also talk a little bit about the process that these folks came to you with? So did they come to you with a proposal, or what did you sort of need from them to help inform the decisions that you and your fellow board members were making on this issue?
One of the tools our commission uses are workshops. We schedule workshops all the time in order to stay on top and be informed on issues of all kinds. And if I'm approached by a constituent or a staff person with a question that requires more than just my own input, which is usually most of the topics we end up with, I'll schedule a workshop. We'll call all the usual suspects together. Getting the sheriff and the prosecutor and the judge and the whole laundry list of people together in a single workshop sometimes is a bit tough, but we can usually get them all to come meet with the commissioners, because after all, we are the budgetary authority, so they have a definite reason to come talk to us. We also have a series of I'll call them councils or committees. Law and Justice is one of them. We also have a mental health committee. We have a number of committees that meet more or less regularly, and sometimes these topics can be brought up there, and the people who, even though the sheriff might not be there at that particular meeting, he'll hear about it, and if he has input, boy, he'll be at the next meeting, and that gets people to show up. Nothing like talking about an elected official behind their back to get them to show up at the next meeting. I think I've covered the question.
Yeah, absolutely. I think that's great. Thank you. And, I think folks are probably finding some similar strategies in their own counties as part of that. So thank you very much. We did have some specific questions for the county folks around how they are defining or mental illness in their county, or who they are specific, if there's a specific definition or population that they are targeting as part of their initiatives. And I don't know, Hallie, if you know that for the Santa Clara team, or could provide any guidance on that, and then maybe we'll have the folks from Pacific County talk about sort of their definitions or who they are targeting as part of their efforts.
Sure, Nastasia. I can say that there are a number of California counties that are looking to various definitions that exist in state statute where serious mental illness is delineated. So they're using those existing definitions because those definitions are the ones that are the eligibility population for grant programs or certain health funding. We've had some counties identify a larger target population as an aspirational scope. So they've identified adult and young people with mental illnesses or substance use disorders who are involved with the justice system or at risk of being involved with the justice system. So a very broad group. That's a very aspirational goal. And then they've used a more specifically delineated population as the group that they're going to measure for their Stepping Up project.
Great. Thank you. Pacific County, any who are you guys sort of targeting, or have you figured that out yet, or how are you defining folks with mental illness for your programs and initiatives?
So that was a good part of our work at the beginning, was really looking at how did we define it, how did the jail define that the population that we wanted to look at. So what we had to do was really take a look at the state definition, what was in our RCW, and what the diet. People who met access to care standards. So, for example, when we did our mental health diversion program, initially with that program, we were only set out or charged to serve people who met assisted outpatient treatment standards. And then what we realized is that was, in fact, too restrictive for us, and that we wouldn't necessarily serve the amount of people. So then we did have to look at, within that program, how did we broaden our definition? So really, just what was just stated is we kind of broadened that a little bit. We look at the definition of, does someone have a diagnosable mental illness or co-occurring substance use disorder? We did not want to not serve people who may be at risk for, if they do not receive services, then later getting to that point of qualifying for access to care standards. So we really tried to broaden our definition in order to front load our interventions.
We also, like for the mental health diversion program, we need to have a link between the diagnosis and the crime. So we're not going to look at getting someone enrolled in mental health diversion if they have a mental health diagnosis and it was completely unrelated to the crime. So the mental health therapist who comes in and does that assessment and makes a reasonable determination that, yes, this diagnosis probably did contribute to the crime. So we had, and that was really from the criminal justice side. They don't want these programs to be tools for people just to, get out of jail if there was no link. So that's the other thing we married it against, was access to care, and then also linked to the crime. The crime links to the diagnosis.
Nastasia, if I can just add a little bit there, that it's been interesting to see counties go through that two-part conversation where people are used to designing a target population for a specific program, like thinking about eligibility criteria for a mental health court or a diversion, and then thinking about how that program's target population fits into a larger group that would be the Stepping Up definition. So it's just been an interesting process thinking through how the layers of who everybody wants to serve, sort of as the broadest, the group that can be measured according to the 4 outcomes, and then the target populations of specific programs or interventions as the finest level of a definition.
Great, thank you, Hallie, and thank you to all of you. We are pretty much out of time, and I know if I ask another question, we're going to go way over time. So for those of you whose questions we didn't get to, like I said, please feel free to join us for the network call on next Wednesday, August 16th at 2 o'clock to dive a little bit deeper and spend some more time talking with the folks who are here on the webinar today. Also wanted to note that the next full webinar for question 6 of the 6 questions document on tracking progress is going to be on October 12th at 2 o'clock Eastern. So please feel free to join us for that. You can register for the network call and all future webinars at stepuptogether.org/toolkit. Just click on the little yellow boxes where it has those, and you can register there just like you did for this one. I wanted to thank our speakers for being part of the webinar again today and sharing their insights. And then I want to jump into just the last minute that we have here to do some poll questions. So we're going to launch these polls, and appreciate everyone taking part in those. I also just wanted to remind you that we do have an evaluation that will launch as soon as you click out of this call, and it'll pop up on your screen, and then we'll also email it to you when we email you the recording. We really do like to get your feedback and ideas, and so please feel free to fill that out so that we can see what's going on. So thank you all so much, and we're going to jump into poll questions. Let's do question 1. Thank you. Next question. Next. Okay, and next question. All right, final question. And just wanted to make a note for those of you who said that they were unsure about whether or not their county had passed a resolution. You can see the full list of counties who have joined by going to stepuptogether.org and clicking on the button that says what you can do. And they'll have the whole list of counties by state who have passed a resolution, and so you can check it out there. You can also get a copy of a template resolution there to share with your county board if you would like to join the initiative. Let's go ahead and close this poll, and we'll close out the webinar. Thank you again, and I hope everybody has a wonderful rest of your afternoon.